Hello everyone, my name is Manuel Lastra and my individual chapter presentation is on chapter 4, Medicare and Medicaid, Major Game Changers. So today we're going to take a closer look at two important healthcare programs in the United States, Medicare and Medicaid. Both programs are designed to provide health coverage to those in need, but they serve different groups of people and have unique features. By the end of this presentation, we'll have a clear understanding of what each program offers, who's eligible, and how they are funded. So Medicare and Medicaid are cornerstones of the social safety net for elderly and impoverished Americans. Over 50 years ago, Congress passed the Social Security Act of 1965, which established Medicare and Medicaid and made hospitals central to the U.S. healthcare system. Medicare is an entitlement program for elderly and chronically ill Americans to safeguard them against bankruptcy due to illness, and this program is financed and administered by the federal government. By contrast, Medicaid is a means tested or need-based program that provides health insurance to low-income adults and children, and the financing and administration of Medicaid is shared between the federal and the state governments. Since Medicaid is jointly administered by the state and federal government, the states have some leeway within federal guidelines in setting the income eligibility limits for Medicaid. So we will take a closer look at Medicare and Medicaid's role in hospitals, patient care, financing, and the impact of ACA changes. So Medicare and Medicaid were both established in 1965, as I previously mentioned, but their purposes and target populations are quite different. So let's start with Medicare. Medicare is a federal health insurance program primarily for individuals aged 65 or older. It also covers younger individuals with certain disabilities or conditions like end-stage renal disease or ALS. So there are four main parts of Medicare, uh, starting with Part A, which covers hospital insurance, included inpatient stays, skilled nursing, and hospice care. Part B covers medical insurance for outpatient services such as doctor visits, lab tests, and preventive care. We also have Part C, also known as Medicare Advantage. It combines Part 8 and B and often Part D and is offered through private insurance. So it may include additional benefits like dental or vision care, but this is in some cases. And lastly, we have Part D, which provides coverage for prescription drugs. So Medicare is funded by payroll taxes collected from employees and employers, along with premiums paid by beneficiaries. So on the other hand, we have Medicaid. Medicaid is a joint federal and state program designed to provide health coverage for individuals and families with low income. It serves a broad range of people, including low-income families, pregnant women, children under 18, elderly individuals, especially those who need long-term care, and also individuals with disability. So each state runs its own Medicaid program, so eligibility and coverage can vary from state to state. So in terms of coverage, Medicaid covers a wide range of services, which may include hospital care, doctor visits, emergency care, prescription drugs, mental health services, long-term care such as nursing home care or in-home care, preventive care like vaccines, screenings, and wellness visit. So states have the flexibility to expand coverage and may offer additional benefits not covered by Medicare, such as dental and vision care in some cases. So eligibility for Medicaid is primarily based on income. but it can also depend on other factors like family size and age. Each state sets its own income limits, and some states have expanded Medicaid to include more low income adults under the Affordable Care Act, which changed the healthcare market in the United States, the healthcare system in the United States. So in general, to qualify for Medicaid, individuals must have limited resources and income that fall below a certain threshold, which varies by state. So again, let's go over some of the key difference between Medicare and Medicaid. Um, so for Medicare, eligibility is for people 65 or older or those with certain disabilities regardless of income. Medicaid is for people with low income, including children, families, and those with disabilities. So coverage, again, Medicare mainly covers hospital and medical care and has additional parts for prescription drugs and managed care. Medicaid provides a broader range of services, including long-term care, mental health services, and more. So in terms of cost, Medicare beneficiaries pay premiums, deductibles, and copays, and Medicaid beneficiaries usually pay little to nothing, with cost sharing varying by state. So funding, again, Medicare is federally funded through payroll taxes and premiums, and Medicaid is jointly funded by federal and state government. Some individuals qualify for both Medicare and Medicaid. These individuals are known as dual eligibles. They are typically low-income seniors or people with disabilities who can receive the benefits of both programs. Medicare covers the basics like hospital and outpatient care, and Medicaid helps with costs not covered by Medicare, such as long-term care or additional services. So this combination of benefits can help cover more comprehensive health needs for those who qualify. Prior to Medicare, older adults were often considered the most bothersome and least desirable type of patients as they were more likely to have multiple illness or diseases and were often unable to pay for their care. After Medicare was enacted, older adults became an attractive source of revenue for hospitals, representing a monumental shift in hospital financing. So this is a graph showing that Medicare enrollment has increased by 187% between 1966 and 2005. So the baby boomers, those are the ones born between 1946 and 1964, who make up nearly 20% of the US population, significantly impact Medicare enrollment. So the number of Medicare enrollees is projected to grow to 92.4 million by 2050. Wow, that's a big number. Aging baby boomers will continue to drive the increase in enrollment and healthcare costs. Um, so more than half of eligible Medicare beneficiaries are enrolled in Medicare Advantage in 2024. So if you take a closer look here in the year 2024, more than 54% of eligible Medicare beneficiaries. So this means 32.8 million people out of 61.2 million Medicare beneficiaries with both Medicare Part A and B are enrolled in Medicare Advantage plans. So Medicare Advantage enrollment as a share of the eligible Medicare population has jumped from 19% in 2007 to all the way to 54% in 2024. So between 2023 and 2024, total Medicare Advantage enrollment grew by about 2.1 million beneficiaries or 7%. So the Congressional Budget Office projects that the share of all Medicare beneficiaries enrolled in Medicare Advantage plans will rise to 64% by 2034. So this figure is just showing us that in 2021, Medicare spending accounted for 10% of the federal budget. So in 2021, Medicare spending net of income from premiums and other offsetting receipts total 689 billion and accounted for 10% of the federal budget. A similar share as spending on Medicaid, the Affordable Care Act, and the Children's Health Insurance Program combined. So, following years of significant growth, Medicaid enrollment declined by 7.5 in 2024, and state Medicaid officials expect enrollment to continue to decline by 4.4 in 2025. These growth rates reflect the net Medicaid enrollment change from year to year, including new enrollments, coverage losses due to unwinding, and some churn when those who lose coverage re-enroll within a short period of time. The unwinding of the continuous enrollment provision was the largest driver of enrollment declines. So total Medicaid spending growth slowed to 5.5% in 2024 and is expected to slow further to 3.9 in 2025. While state Medicaid officials identified unwinding related enrollment declines as the most significant factor driving changes in total Medicaid spending, they also noted a number of upward pressures on total spending. As anticipated, state Medicaid spending growth increased sharply in 2024 with a 19.2% as the enhanced FMAP phased down and expired after declining earlier in the pandemic despite high enrollment growth. So state Medicaid spending growth is projected to slow to 7.0% in 2025, only slightly higher than total spending growth as the chiefs caused by the enhanced FMAP expiration end. So some initial impacts of Medicare. So it improved healthcare services. Medicare required healthcare facilities to meet specific standards, improving services and increasing resources for healthcare systems. It also influenced on accreditation and staffing. So Medicare incentivized hospitals to update physical environments, improve accreditation standards, and expanded roles for pharmacists and nurses in the hospital setting. Civil rights impact. So the combination of Medicare and the Civil Rights Act of 1964 helped eliminate segregation in hospitals, expanding access for Black patients and physicians. So workforce changes. So Medicare facilitated the emergence of new medical specialties and allow rural hospitals to more easily recruit physicians by covering training costs. Also, we have financial relief. So prior to Medicare, elderly Americans spend over 10% of their income on healthcare, and Medicare reduced out-of-pocket medical costs by 40% for high spenders. Health outcomes. So Medicare decreased health disparities related to race and education, providing financial protection for older adults and contributing to improve health outcomes. So Medicaid has had a significant impact on healthcare access, especially for low-income individuals and families. So research consistently shows that Medicaid beneficiaries experience better health outcomes than the uninsured, as they have improved access to care and lower financial burdens. A major contribution of Medicaid is in maternal and child health. It covers a substantial percentage of births across the US, helping to reduce infant and child mortality rates. Additionally, Medicaid has been linked to better long-term educational outcomes, as children with access to healthcare tend to have fewer hospital visits and better school attendance. The Affordable Care Act further expanded Medicaid coverage, increasing access to preventive and primary care services. Um, Studies have shown that this expansion has contributed to lower mortality rates and improved overall health for low-income populations. By reducing economic barriers, Medicaid continues to play a vital role in healthcare uh, equity and access. So now we're gonna dive into some of the major concerns about cost control. So Medicare and Medicaid payments are determined by legislation rather than negotiated rates like private insurance are. So this often results in lower reimbursement rates for hospitals, creating financial challenges, of course. So to control cost, Medicare introduced the Prospective Payment System or PPS in 1983, shifting from cost-based payments to fixed reimbursement per diagnosis-related groups. Other cost containment efforts include penalties for high um, readmission rates and adjustment through the Balanced Budget Act. However, as Medicare enrollment continues to rise, concerns about the program's long-term financial stability remain. So, the role of the Affordable Care Act. So, although one of the main aims of the ACA was to increase health insurance coverage for the non Medicare population, the Medicare program experienced significant changes under the ACA. So, first, like private sector insurance, the ACA requires zero cost sharing for preventive services for the Medicare beneficiaries. The ACA also helped address the donut hole in Part D program by covering more of the cost to seniors in the coverage gap. So it also extended Medicare Hospitals Insurance Trust Fund solvency from 2017 to 2029. In addition to expanding Medicaid in participating states, the ACA also decreases DSH payments, which have important implications for hospitals' financing, particularly hospitals that serve a higher proportion of low-income patients. The ACA also created a Center for Medicare and Medicaid Innovation, which is charged with creating, evaluating, and diffusing innovations to lower costs, provide better health outcomes, and improve patient experiences through the Medicare and Medicaid programs. In addition to payment reform, the ACA created incentives to increase quality and reduce costs. For example, hospitals are penalized for readmissions above the national average based on the National Quality Forum's benchmarks and hospital acquired infections. Um, Introduce quality based hospital penalties and value based purchasing incentives to improve patient outcomes. So, Medicare and Medicaid, resulting from legislation passed in 1965, dramatically changed the delivery of healthcare in the United States by providing public insurance to vulnerable populations, primarily the elderly and the economically disadvantaged. Medicaid improved access to care, increased healthcare utilization, improved self-reported health outcomes, and reduced catastrophic medical expenses for more than 65 million Americans, and has been instrumental in improving care for expectant mothers and children. Medicaid reduced the financial barriers to healthcare for much of the lower income population. Medicare and Medicaid have, however, raised many concerns about continually increasing costs. Both Medicare and Medicaid continue to evolve in certain dimensions as financial problems continue to arise and as the landscape is periodically altered by federal legislation. So, in conclusion, while both Medicare and Medicaid provide essential health coverage, they serve different populations with distinct needs. Medicare as I mentioned, is primarily for older adults and individuals with disabilities, whereas Medicaid supports those with low income, offering a broad range of services. So understanding these programs is crucial for navigating healthcare options in the United States and for making informed decisions about coverage for yourself and our loved ones. So here are my references. Thank you so much for watching and hope you enjoy my presentation.